The humerus is the long bone of the upper arm, and it has a lot of similarities to the femur in the leg. The head of the humerus forms a ball and socket joint. Then we have the shaft, and we have two condyles at the end, at the distal end, and some other lumps that are in some ways similar and in some ways different. So we have the head of the humerus, and then we have the anatomical neck. This is called the anatomical neck to distinguish it from the surgical neck, which is right in here. So the anatomical neck is basically the equivalent of what we saw as the neck in the femur. And then the surgical neck is so called because this is where a lot of breaks happen that require surgery. If you remember in the femur, the femoral neck was relatively thin, and that's actually where a lot of hip fractures occur in the femur. But in the upper arm, this neck is pretty thick. The anatomical neck is pretty thick, and the surgical neck down here is where breaks more frequently occur. Similarly to the femur, we have two kind of let's see if we can get this here. Two big kind of ridges of bone. But instead of trochanters, these are called tubercles. It's basically a similar thing except smaller. So we have the greater tubercle and the lesser tubercle. And then in between them, we have the bicipital or intertubercular groove. So that's this long groove right in here. And then kind of right in the middle of the shaft of the bone, we have this tuberosity. It's called the deltoid tuberosity because these are where the deltoid muscles in your shoulder attach. So your deltoid muscles in your shoulder are up here, and they come and they attach to the arm at the deltoid tuberosity. On the distal end of the humerus, we have a few more bony landmarks to look at. So let's see, we have right here, we can see the condyles again. So we have the medial condyle and the lateral condyle. And then we have the capitulum right here. So capitulum, capitis, like head, capitis. So the capitulum is a round thing kind of resembling a head, I guess, if you're creative enough. And then on the other side here we have the trochlea. Trochlea just means like resembling a pulley, like a mechanical pulley. And then above it we have the coronoid fossa, not to be confused with the coracoid process of the shoulder, of the scapula. And this little indentation right here is where this little jut out part of bone right here, the coronoid process, goes in when you flex the arm. So having that indentation gives us a little bit more range of motion in flexion. And then if we go around and look at the posterior side of the humerus, we can again see the trochlea a little better. The trochlea, if we remove the ulna, then we can see the trochlea here. And you can see how it looks kind of like a pulley or like something a rope would slide over. And then we also have the olecranon fossa, which we just saw a second ago. The olecranon process on the ulna kind of fits into there, and that's what stops hyperextension of the elbow joint. And then the last thing is the lateral condyloid ridge. So this is the lateral condyle, and this ridge right up here, you can kind of see, this is the lateral condyloid ridge. And like any ridge, it serves primarily as a place of attachment for muscles.